I want to welcome everyone to our audit committee meeting this morning. On the agenda this morning will be the presentation of the performance audit for Medicaid and Peach Care Managed Care. However, I want to just call to order and ask who, as it relates to the audit committee members, who's on the line. And I'm just going to call by name. Mr. Mark Trail, are you present? Mr. Russell Crutchfield, are you present? Mr. David Cruz.
The host just unmuted us.
Okay.
Russell's here. Russell Crutchfield's here.
Okay. Mr. Mark Trail. And Mr. David Cruz, who's the audit committee members.
Yes, Lisa, did you hear me? I'm here, David.
Yes, okay. Thank you, Mr. Cruz.
Thank you.
We can move forward with proceeding in terms of the review of the minutes from the December 2019 audit committee as it relates to the presentation for the statewide audit corrective action plans for 2018. After review of the minutes, I just asked for audit committee members to approve the review of the minutes as it relates to the December 2019 audit committee meeting.
This is Russell Crutchfield. I'll move to pass that review of minutes.
Second
David Cruz, second.
Thank you. We approve the review of the minutes from December 12th, 2019 audit committee meeting. Next on the agenda will be our Inspector General for the Department of Community Health, Sonia Allen, and the Executive Director, Lynette Rhodes, for the Medicaid Division. So I'm going to go to pass that off to Sonia to move into presenting the presentation. Kiana, there's a little feedback. Someone might have their cell phone on. And if so, okay. If someone has their cell phone on, could you mute, please? Okay. Sonia, I'm going to pass it on for you and Lynette to start the presentation for the program integrity audit.
Thank you, CFO Lisa Walker. I appreciate that. Good morning, Audit Committee Chair Childers, Audit Committee members. I am Sonia Smith, the Inspector General for the Department of Community Health. I will be co-presenting with Lynette Rhodes, the Executive Director of the Medical Assistance Division.
And good morning, everyone. This is Lynette Rhodes. Thank you for the opportunity to present.
So today, this morning, we will present the most recent Department of Audits and Accounts performance audit report entitled Medicaid and Peach Care Managed Care, Lack of Coordinated Integrity Efforts Increases Risk of Improper Payments. Next slide, please. Next slide, please. Thank you. Our agenda this morning includes reviewing the purpose of the report, discussing the 3 themes we identified in this audit, as well as a quick review of the Medicaid and Peach Care payments for the same time frame that the audit covers. This report resulted in 11 findings and 23 recommendations. We are prepared to walk through the corrective action plan with you. which was emailed to you along with the presentation, this presentation that you see on the screen last week. Lastly, we have time at the end of the presentation for questions. However, I understand that the audit committee is interactive. Therefore, please feel free to stop us at any time to ask any questions. Next slide, please. Okay, the Department of Audits issued Performance Report 1805 this past July, which examined the program integrity activities associated with Medicaid and Peach Care Managed Care. As you know, performance audits are directed at improving state operations. For example, to determine if the program being reviewed is actually accomplishing its goals and objectives. Program integrity activities are critical in detecting and recovering improper payments. CMO program integrity activity occurs within each CMO and is monitored by the MAP division under the Contract Compliance Unit, which Lynette will speak to later in this presentation. And the Office of Inspector General has traditionally only been responsible for fee-for-service program integrity. I too will later speak more to that, particularly around some recent changes that we've made that will assist the Office of Inspector General in playing a bigger role with the CMOs. Next slide, please. As I mentioned in the agenda, there were 3 themes that we identified from the findings and the recommendations. The 3 themes are a lack of coordinated program integrity efforts, CMO contract changes, and improving our current program integrity activities. So I'll begin with the first one, coordinated activities. I mentioned earlier that program integrity happens in both OIG for the fee-for-service world and in each of the CMOs. It is important for me to share with you that the Office of Inspector General and the CMOs meet quarterly and have been since the spring of 2018 to share knowledge around program integrity activities. This meeting is coordinated by our office with attendance from each of the CMOs, SIU units, Special Investigations units, where they do program integrity. This meeting is also attended by the MAP division, the Contract Compliance Unit, as well as the Attorney General's Medicaid Fraud Control Unit. This model has been applauded by CMS and often shared as an example for other states of how we should function together. Now, we agree with DOAA that increased efforts, especially with communication around all entities regarding program integrity, could certainly be improved. Next slide. The second theme relates to changes that must be made via the CMO contracts. There are quite a few findings and recommendations that will result in better coordination between the CMOs and fee-for-service by defining standards and goals, especially around prepayment reviews, provider investigations, and contract terminations. These actions would lead to improved program integrity efforts, but will require contract changes. I'll let Lynette speak to the needed contract changes.
Hi, good morning again, and thank you, Sonia. Can you all hear me?
I hear you, Lynette.
Okay, thank you. So as Sonia indicated, this audit finding recommended that we make changes to the contract. So upon receipt of the audit findings, we completely revamped the program integrity section of the CMO contract. The new provisions are included in what we are calling the amended and restated CMO contract. The revised contract was submitted to CMS on July 1st, and is now pending CMS approval. Generally speaking, CMS has a window of 90 days in which to approve contract revisions. And so we are hoping to receive notice of approval by the end of September. We do have a conference call with CMS today to get a status update. So we'll know later today where we stand in terms of CMS's review of the revised contract. I'll walk through a few of the changes that we've made to the contract and demonstrate how they resolve and address some of the findings. As a starting point, each of our managed care entities must have a program integrity unit whose primary purpose is to reduce the incidence of fraud, waste, and abuse. So we've added some additional provisions as recommended by DOAA. One of the provisions that we've added is that each CMO must conduct a risk assessment of identified providers who have been investigated by DCH or another CMO, or identified as a risk for improper billing patterns. And this is to determine if further actions, including but not limited to investigations, prepayment review, post-payment review, suspension, or termination should be taken. So this particular provision addresses the concerns identified by DOAA in finding number 1. And it goes directly towards the concerns regarding the lack of coordination between both fee-for-service and managed care. We're also requiring in the contract that each CMO develop and submit their policies and procedures to the department, outlining their processes for educating and training their staff on how to detect and prevent fraud, waste, abuse, and overpayments. We're also requiring that each CMO analyze payment trends for their providers to identify questionable claim patterns indicative of fraud, waste, or abuse, and to determine if corrective action should be taken. And this was one of the findings that DOAA outlined in finding number 2. We also included provisions regarding telemedicine services, and we're requiring the CMOs to include procedures specific to the prevention and detection of fraud, waste, and abuse in the areas of telemedicine. We're requiring the CMOs to provide reports summarizing the results of their investigations of fraud, waste, and abuse or overpayments, which were conducted by the CMO's fraud investigative units. We have clearly outlined the report frequencies, which are now going to shift to monthly, quarterly, and annually. And within these reports, we are expecting to receive information regarding prepayment reviews, post-payment reviews, investigations, and provider terminations. So again, those are from a high level, some of the provisions or revisions that we've made to the CMO contract. If you have additional questions on those, I can definitely take those, but just wanted to give you a high level overview of where we are today. And again, those proposed revisions are now pending with CMS. So Sonia, I'm going to turn it back over to you.
Thank you. Next slide, please. This slide represents our third theme, our final theme, which included improving our current program integrity activities. There were several findings and recommendations intended to provide opportunities for improvement, such as defining the CMO reporting requirements in an effort to better identify provider trends, and to evaluate CMO program integrity activities. We'll also use those recommendations directed us to refine the usefulness of our report, as well as define the reporting requirements. Lastly, the Department of Audits identified an opportunity for OIG to better communicate the results of CMO Medicaid Fraud Control Unit fraud referrals in an effort to better monitor audits so that they don't age out for the CMOs. Next slide, please. As mentioned previously, both by Lynette and myself, program integrity is about detecting, preventing, and addressing fraud, waste, and abuse. DOAA estimated that $41.1 million in Medicaid and Peach Care payments were not subjected to adequate oversight between the years of 2013 and 2019. During that same time frame, DCH spent $73 billion in Medicaid payments. That's approximately $10 billion to $12 billion annually. And actually, DCH spends about $30 million in Medicaid payments in a day. Next slide. It is important for us, however, to recognize that DCH, the MAP division, OIG, and that the CMOs should work together to improve these program integrity efforts to make sure that our capitation rate is ultimately correct. Next slide. So before we get into the findings and recommendations, Lynette and I would like to share with you some of the changes that both MAP and the Office of Inspector General has experienced over the last 2 years that makes us prepared to move forward with implementing these recommendations. Lynette, I'll let you go first.
Great, thank you, Sonia. And so as mentioned, one of the recommendations from DOAA was that we change our organizational structure. As noted in the report findings, and as Sonia has mentioned this morning, we operate 2 service delivery systems, fee-for-service and managed care. In 2018, the Medical Assistance Plans Division reevaluated its existing organizational structure and its business processes. We identified the need to streamline our processes for both fee-for-service and managed care, thereby eliminating silos and improving coordination. We began what we called our Organizing for Success initiative. The purpose of this initiative, again, was to streamline our business processes and workflows, to clarify the roles and responsibilities within the MAP division, and more importantly, to improve alignment with DCH enterprise level functions and activities. We engaged Ernst & Young, a consulting firm, to assist in the planning, development, and implementation of this initiative. As a part of the planning and development stage, we reached out to other state Medicaid agencies to determine how they were organized. And as a result of this work, the Medical Assistance Plans Division was reorganized into 4 new offices. And I will walk through those offices now. The first office is our Eligibility and Enrollment Office. And so this office is primarily responsible for the activities required to qualify and enroll members and providers into the Medicaid and Peach Care for Kids program. The second office is our Service Delivery and Administration Office. This office is responsible for the monitoring and oversight of our care management organizations, ensuring that our CMOs are complying with the provisions of the contract, and ensuring that our Medicaid, Peach Care for Kids, and Planning for Healthy Babies members are receiving medically necessary services. This unit is also responsible for the monitoring and oversight of fee-for-service. One of the things that was mentioned in the DOAA report is the quality of the reports submitted by our CMOs. That function will also fall under the Service Delivery and Administration Office. The third office that we established was the Performance and Care Management Office. And this office is responsible for activities related to improving the quality of member care and outcomes. And the fourth office is our Policy, Compliance, and Operations Office. And this unit is responsible for strategic planning, policy development, and monitoring and oversight of the division's business processes and operations. And this is to ensure that we are in compliance with both federal and state law. The establishment of these offices will ensure that we are eliminating silos and that we are improving coordination and communication across both fee-for-service and managed care. So Sonia, I'll turn it back over to you.
Thank you, Lynette. In the same spirit in which Lynette spoke about her changes, I'd like to mention to you the changes that we've made in the Office of Inspector General to prepare ourselves to be ready to implement these recommendations. The Office of Inspector General also collaborated with Ernst & Young to implement a new program integrity unit within OIG. Previously, we operated with two distinct units, a data unit as well as a program integrity unit. The reorganization combined the two teams into one and has allowed us to streamline our processes to be better with our Medicaid audits. We are prepared to implement these recommendations as we have now become the single point of contact for program integrity within DCH, as recommended by DOAA. We have already started to implement the recommendations in the audit, particularly with these certain items that we've already started. We started making our quarterly collaboration meetings more meaningful by, as Lynette suggested, breaking down the silos and looking at things from a holistic enterprise approach, not just fee-for-service versus CMOs. We look at the entire provider regardless of the payer. We are reworking our quarterly reporting tool, establishing reporting requirements so that we can be effective with the work that we receive from the CMOs, as well, not just the quarterly report, but also the monthly reports as well. We are engaging closer with the CMOs on the Mafuku referrals to make sure that we're timely in letting them know where Mafuku stands with those results. We have also started to evaluate our prepayment review process for both fee-for-service and CMOs to make sure that we identify which practice is best for the both of us, both Department of Community Health as well as the CMOs. Next slide, please. We have, as I mentioned previously, 11 findings. Next slide. We also have 23 recommendations. Next slide. I am prepared to walk you through the CAP if you'd like. We have two main dates on the corrective action plan that you may notice. There's a July 2020 date as well as a July 2021 date. 4 of the 23 recommendations were things that we thought we could do now, particularly as a result of the reorganization and because we thought it was important to go ahead and do it now. The remaining 19 recommendations have a July 2021 date to allow us time to work through the contract changes and to make sure that we work in a coordinated way to understand from the CMOs what's important to them as we reshape our agency program integrity efforts. I'll pause for any questions before I move into the corrective action plan, if that's what you would prefer, if that's what you would like to do. Are there any questions that we can answer? Okay. Kiana, you want to pull up the cap?
Sure thing, one moment.
Thank you. I'll take a few minutes and explain the layout of the corrective action plan document. On the left-hand side, you'll have the findings. In the left-hand column, you'll see the findings, the recommendations in the middle, as well as our corrective action plan to the right. Under the corrective action plan, there are 3 columns. You'll see our actual action that we recommend to address the recommendation, as well as the unit and the time frame by which we intend to implement that action. I'll also mention to you that in the findings box, you will see a number in parentheses, P8 for number 1. That aligns with the page in which the findings shows in the actual report. And then I'll also address for you the blank line between, the blank box between 1 and 2 on the findings. What that means is that for finding number 1, there were 2 recommendations. So where you see a blank box, I will talk to the findings and share with you the recommendations. I will also do my best not to read this document to you, but to discuss it in a summary level. So the first finding has 2 recommendations. Finding number 1 is that our program integrity efforts are fragmented and uncoordinated, which increases the risk of undetected and uncovered improper payments. The recommendation is that DCH should use an enterprise perspective when assessing and addressing questionable payments, and that DCH should assign responsibility for program integrity to a single party. Our corrective action plan is that effective July 1, 2020, OIG program integrity became DCH's single party responsible for program integrity efforts. Additionally, we have started to take an enterprise approach to assessing questionable payment trends. So as I mentioned previously, we've started that work now. Finding number 2 is that DCH does not analyze payment trends across Medicaid payers once a questionable claim pattern indicative of fraud or abuse is identified. The rec is that once a pattern of questionable claims is identified, we should analyze the payments across all providers. This too is one that we have started doing now, and that we have established a communication tool such that when questionable trends have been identified either by DCH program integrity, OIG program integrity, or by the CMOs, that we share that information with each other in an effort to provide awareness. Next page, please. All right. Finding number 3 has 1 recommendation. DCH does not notify CMOs of providers DCH has identified as a potential risk. The recommendation is that DCH should inform CMOs of providers we have identified as a risk to enable the CMOs to implement timely detective and preventive controls. Again, this is one that we've moved forward with immediately, and that we're establishing that communication tool so that we can share information as a point of awareness. Finding number 4. Finding number 4 has 1 recommendation. DCH does not ensure that all payers analyze claim data for providers placed on prepayment reviews by one payer to determine if the other should take similar actions. A recommendation is that DCH should revise its contracts to direct CMOs to conduct risk assessments for those providers who have been identified as a risk by other payers to determine if they should take similar actions. This requires a contract change. Lynette mentioned that we have made those changes or recommended those changes in the contract, which is currently sitting with CMS. Finding number 5 has one recommendation. DCH does not ensure that fee-for-service and CMOs review claims data for providers investigated by other payers to determine if they should so also investigate. Again, this recommendation requires, the recommendation is that DCH should revise its CMO contracts. This is one of the changes that was included in the contract change that Lynette mentioned earlier. Next page. Finding number 6 has 2 recommendations. The finding is DCH does not ensure that CMOs consistently report determination of provider contracts due to concerns of program abuse or non-compliance. The 2 recommendations are that DCH should revise its CMO contracts, and that we should develop a framework that allows for informal communication regarding provider termination. Regarding the CMO contract, that's in process. Regarding the framework, we are working today to develop that communication between DCH and CMOs to communicate provider termination. So we're working through that right now. Finding number 7. Okay, finding number 7 has 4 recommendations. The finding is that DCH has not defined acceptable levels of CMO program integrity activity, or developed objectives for determining if the CMO activities are effective in identifying and preventing improper payments. The first recommendation is that we should clearly define standards and goals in the CMO contract. That's underway. The next recommendation is that DCH should analyze CMO activity reports to identify trends. The OIGPI, Program Integrity Unit, is currently analyzing those reports, or started to analyze those reports to identify trends. The recommendation is also to establish performance standards related to the timeliness of investigations. That too was some language that we discussed, Lynette discussed regarding contracts. The next recommendation is that DCH should start tracking overpayment recoveries resulting from program integrity actions. I'm sorry, Kiana, would you move the screen, please? Thank you. I'm on the, I'm on number 10, I'm on number 11, regarding establishing performance standards related to the timeliness of the investigations. As mentioned, that's included in the contract changes that was submitted to CMS. The next one, which is number 12 on the recommendations, DCH should track overpayment recoveries resulting from program integrity actions. We will begin tracking those, but it may also make us need to revise the contract to identify performance goals related to the CMO overpayment recovery. So we're working on that one. Next slide, please. Number 8, this finding has 4 recommendations. The finding is that DCH does not ensure that program integrity investigations information reported to CMOs is accurate. The recommendation is that DCH should consider eliminating duplicative reports. The next recommendation is that if 2 reports are continued, DCH should review the reports for to identify potential discrepancies, gaps, and errors. The next recommendation is that DCH should require CMOs to report potential and actual overpayment recoveries. Would you go to the next slide, please, Kiana? The next recommendation is that DCH should develop an information system which will enable program integrity to track the CMO's caseload. Regarding the corrective action for this, DCH OIGPI will evaluate these reports and create a standard reporting tool. We will also track the current caseload for the CMOs. While we don't believe we need to develop an information system, we currently track the fee-for-service caseload. So we started discussion, or will start discussion, with Office of IT, Information Technology, to determine the best way to incorporate the CMO caseload information into what we're currently tracking for fee-for-service. So I'll move on to number 9. Right, say right there. Number 9 has one finding with 2 recommendations. DCH, the finding is that DCH does not ensure that it receives or communicates or has communicated accurate and timely information regarding CMO fraud referrals or the status of the CMO fraud investigations. The recommendation is that DCH should develop an information system which will enable program integrity to track cases referred to Mafuku. The next recommendation is that DCH should issue notices to CMOs when Mafuku investigations have concluded, enabling the CMOs to resume their investigations and recover associated payments. Our corrective action plan is that we currently track our fee-for-service Mafuku referrals. Again, we will work with our Office of Information Technology to determine how to best incorporate the CMO referral information into what we're doing today. We also will work with the CMOs to formalize a process to track and notify CMOs when Mafuku has concluded an investigation. Next slide, please. Number 10. Number 10 finding has 3 recommendations. The finding is that DCH does not monitor CMO cases to ensure that actions, including fraud referrals, are made within the statutory time limits for administrative recovery. The recommendation is that the General Assembly should consider exempting the CMO Medicaid operations from its relevant statute that limits the amount of time CMOs have to conduct post-payment audits and recover associated payments. The next recommendation is that DCH should implement procedures to monitor the status of CMO cases to ensure that all actions will occur within the specified time frame. Next slide, please. And then the final recommendation is that DCH should implement procedures to track the status of Mafuku investigations to identify any CMO cases at risk of aging out of eligibility for administrative recovery and request that Mafuku expedite their prosecution decision. Regarding the recommendation to the General Assembly, we found that recommendation is directed to the General Assembly and requires a law change. If the law is changed, DCH will comply. Regarding the recommendation to implement procedures to monitor the status of CMO cases, we are working currently to develop a process to make sure that we monitor the status of all of those cases and that we serve as a in-between or as a conduit between the CMOs and Mafuku. And we've also had discussions with Mafuku about monitoring those cases and including them meaning CMOs in our meetings with Mafuku. So we will begin monitoring the CMOs in this way as soon as we can get that up and running. The last finding is that DCH does not ensure that CMOs monitor their subcontractors' performance in preventing and detecting and recovering improper Medicaid payments. This particular finding, Kiana, if you will go to the next page, please, has two recommendations. The first recommendation is that DCA should implement procedures to ensure that contract documents contain the necessary program activity and reporting requirements. And the next recommendation is that we should implement procedures to review information reported by CMOs for indicators that their subcontractors are conducting program integrity activities at a satisfactory level. Our corrective action plan for both of these recommendations is that we will revise the contract to ensure that any subcontractors comply with the reporting requirements, and that we, as Office of Inspector General Program Integrity, that we develop a process that as we review these activities of the subcontractors, we will make sure that they too are conducting their PI activities at a satisfactory level. That is the conclusion of my report, or our report. I would like to answer any questions if you have any.
Are there any questions? Well, thank you for the report. We apologize for my problem with technology and the fact that a tree fell on the power line to my office. But we hope we'll be glad when we're able to come to the office to review the information. And we always count on you and your office to keep everything in line with the huge amounts of money that pass through our department. So thank you very much for your work and your department's work.
Thank you very much. Thank you, Lynette.
Thank you.
This is Lisa again. Mr. Charles, you want me to move to the next item on the agenda?
That would be great.
The next item on the agenda is for me to just offer comments as it relates to the audit committee. This is once again, this is the first time that we've met since the public health emergency was declared back in March, and hopefully we'll get back on our quarterly schedule in terms of our audit committee meetings. I would say that this is the audit committee meeting for the program integrity audit. We also will have another audit committee meeting next month as it relates to the 2019 statewide audit. And after that, we will get back on a quarterly schedule as it relates to the audit committee moving forward. And hopefully we'll stay on task as it relates to those committee meetings and bring information before the audit committee and the board as it relates to our internal operations, fiscal internal operations. Those are all the comments that I would like to make as it relates to the audit committee and how we're going to progress moving forward. And once again, if there's no questions, we can adjourn the meeting as it relates to the audit committee. And we will say that we will keep you updated as it relates to the ongoing efforts with this particular audit and on future audit committee meetings as it relates to the program integrity audit or any other information as it relates to our fiscal internal operations. But at this moment in time, I'll adjourn the meeting, Mr. Childers, if there's no further questions or if you don't have any further comments.
When we get together next month, I would appreciate, and it doesn't have to be very detailed, but I think all of the board members would have some concerns given the health problems we've been having and the reaction to those health problems, both as a state, but more importantly as a department, and what I would think would be huge numbers of people that utilize our programs, both the state health benefit plan and the Medicaid program, in terms of receiving treatment over the last, I guess it's been 6 months at least. I'm sure that's putting a strain on our budgets and those kind of things. So we'd love to hear sort of an update of how the current things are going when we get back together. And it doesn't have to be very lengthy, just an idea of, I guess my concern is how much bigger it is than it normally would be. So, and how we're able to cope with that. So we appreciate your hard work, and we'll look forward to getting together with you again next month.
But thank you, Mr. Childers, and we will look at addressing those issues that you just mentioned. And once again, I would like to say that if there's no additional questions or comments, we can adjourn the audit committee for this today.
Well, thank you very much.
Thank you.
Adjourned. Yeah.
Mhm.
Thank you.
Thank you.